patient is coming to see me because they have an ovarian cyst, there are a few factors we take into consideration when deciding whether or not surgery is the right option for them. And we're going through that in this video. My name is Eric Schmidt. I'm a board-certified OBGYN, minimally invasive gynecologic surgeon, and we're doing a fundraiser for Gynecologic Cancer Awareness Month. And so if you're able to give, there is a GoFundMe down below. We have other videos on ovarian cysts and how I approach them on the main YouTube channel, and so check those out for a more lengthy description on a lot of these topics. Okay, so factors that may contribute to the decision for surgery or not. Number one, pain. This can be complex. Some cysts, hemorrhagic cysts that bleed into themselves, causing actually quite a bit of pain. And we see a lot in the emergency room. Well, these cysts actually we try not to operate on because often they resolve on their own. And there are some exceptions to that. Number two would be a large cyst, sometimes pushes on different surrounding organs or tissues, causing bulk type symptoms. That might be a cyst that we might want to remove to alleviate those symptoms or find out what type of cyst that is. And what is a large cyst? 7 to 10 centimeters generally is kind of the accepted, like, okay, we should potentially intervene because this could cause more problems. And then the worst type of pain someone can get with a cyst is often what's called a torsion. When the cyst starts to twist on itself, the blood flow kinks like a garden hose, and that ovary starts to become necrotic. And that can be extremely painful, some of the worst pain I've ever seen. And factor number two, we talked about in the previous video, but is, are we suspicious that this could have any potential chance of malignancy? And if a cyst does, often we need to potentially remove it to truly figure out what it is. And so that often is a big player on the decision for surgery or not. And the last factor I'll talk about is endometriomas. Endometriosis type cysts. Often we're leaning more towards surgery for those type cysts. Those type of cysts, they can cause more inflammation, more symptoms, IBS symptoms, bladder symptoms, and they can cause scar tissue of the surrounding area to the tubes. The tubes are very delicate. And so those can often potentially cause more damage, why we start to lean towards intervention for endometriosis cysts earlier. For example, if an endometriosis cyst is like 2 centimeters or 3 centimeters, we might recommend potential surgery for it. There are medication options, but versus like a dermoid cyst, a benign cyst that doesn't have a lot of inflammation associated with it, those can definitely be watched for a longer period of time. I hope this helps. We'll talk to you soon.